I'm Bobby Kalani with Options for Elder Care. We are a premier geriatric care management service in the Pittsburgh area. We provide care management services not only for the elderly but for the disabled. And we do provide service in and around all the counties that surround Allegheny County and Pittsburgh. If you need further information on our service, go to optionsforeldercare.com or feel free to give me a call, 724-443-6015. We're a small company. I'm the owner. My name's Bobby Kalani. I am a nurse I have a master's degree and about 40 years of experience in the care management industry. And small company, I do answer my own phone. I have 3 nurses and a social worker that provide care management services for us. And in a combination of all of our experience, you're probably getting about 200 years worth of care management experience. The most frequent question we get is, what does an assessment involve and how do I get that process started? So this video is going to give you some information on what an assessment is and the different types of assessment that we offer. Options for Elder Care, we offer 3 types of assessments: a life care plan, a mini assessment, or an emergency assessment. I'll go through what they all involve. What the life care plan involves is a very detailed life projection of needs that you're going to have throughout the lifetime of the individual that we're providing the assessment on. Typically, families or relatives of families are the ones contacting us requesting service. What a life care plan involves, it's a complete assessment. So we will do, we're frequently called with concerns with cognitive issues, memory issues, or we're not quite sure what it is, but we have concerns. So we will do a complete cognitive assessment and give you some idea of where we feel the person's at, and we can make recommendations for evaluations of some type if that's needed. We also, since we are primarily nurses, we do a complete physical assessment and disease management assessment. But since we are holistic, we not only manage the disease, but we manage health, and we put into place things that will maintain and improve the health of the individual. We do a complete psychosocial assessment also to look at all the things that are going on psychosocially, which would impact the health. We look at all the medication that the person is on. There's a tremendous amount of polypharmacology in today's society over medications, and in the elderly this really comes into play. We'll talk with the family about recommendations that we have, and then bring that to the physician to make the final determination. Also look at all the legal things that need to be in place as someone ages or with disability, things that need to be in place, and if necessary, make referrals to appropriate types of attorneys to manage that. In order to do an adequate life care plan, we need to include the finances. We need to project within your budget recommendations for the future. And included in the financial analysis will be, besides projections, we'll be looking at any entitlement programs that you could qualify. Examples of this may be programs through the Area on Aging, programs through the VA, long-term care insurance programs. With the other things, most of us have worked in one capacity or another in the insurance industry in the Pittsburgh area, so we do an analysis of the current health insurance you have, long-term care policy, or disability insurance, and we make sure that you are maximizing the programs that are offered through your insurance, and we can help you negotiate in any way with your insurance carrier. We also look at, of course, the living environment, making sure it's the most appropriate and safest place to live, offering recommendations on that. And if it's determined that it isn't safe to be living in the home, which is the ideal, then we are experts in the services that are available in and around the Pittsburgh area, such as personal care homes, assisted living, and if ever needed, skilled nursing. And we can provide you with what we feel are the best providers of those services in the Pittsburgh area. And we also look at the family dynamics. Always are an important aspect of of what we're looking at when we're completing an assessment, and just be aware that every family thinks that they have the biggest family concerns going on, and it's fairly normal for families to have dynamics, and we can help you deal with that component of that. So part of what we do with the assessment is we initially get input from the family, get their opinion on what they feel is wrong, and we do have a questionnaire that a very detailed questionnaire. It's very customized. We do a lot of research after we conduct our assessment. And then when we're physically doing the environmental assessment and the physical assessment of the patient's or the client's home or wherever they happen to be living, we are observing many things, and we will include our observations within our Life Care Plan. Our Life Care Plan is a document that's approximately 20 pages. We will send that out to a family, and the best part about the Life Care Plan is at the end of the Life Care Plan, we have what is called a family meeting. We encourage all family members to attend the meeting. If need, we could Skype people in, telephone conference, whatever. The idea behind the family meeting is for everyone to have input into the plan going forward, and for them to also understand the whole dynamics of what the care for this person involves, and then everyone can pick a piece of it. Typically we find a lot of families there's one person or maybe two that are handling the majority of the responsibilities. So it's in my opinion, it's the best part of the whole Life Care Plan. But not everyone has the finances for a Life Care Plan or the time to. It does take time for us to complete the document, or it doesn't have the time for that. So we do offer a smaller version of the Life Care Plan, which we call a mini assessment. The mini assessment is we're still looking at some of the components. We're not projecting as much in the future or projecting immediate needs, and we do not provide the family conference at the end, but we do provide a telephone conference call, approximately an hour, where we're reviewing our plan. Less detailed, takes less time to complete, and is not as does not project into the future as the Life Care Plan would. Now, the very final thing that we offer for an assessment, because there's always emergencies, is an emergency consult. To do an emergency consult, reasons for that are typically maybe the person's hospitalized, a care manager has told them they can't go, they can't be discharged, your family has to find a personal care home, skilled facility, or assisted living within the next 2 days, and you would call us up and we would do what's considered an emergent consult. That's just one example. What we do is we physically go in, complete a very quick assessment, and offer our opinion right then and there and on the spot. So those are the 3 types of assessments that we offer at Options for Elder Care. After an assessment is completed, you have the option of continuing with our services, our long-term care management services, and I'll provide another video on that at another time. Thanks for listening, and if you need to reach me, please go to my website for detailed information, optionsforeldercare.com. Feel free to call me, 724-443-6015, or you can email me at optionsforeldercare@comcast.net. Thanks, and you have a great day.